Good evening, everyone. I'm Dr. Shailesh Gupta. So, continuing a series of mastering variance revision page by page. Today, I'm going to cover in the lecture series Colon and Rectum. We're going to discuss the surgical anatomy physiology part 2. So, basically, in this part, I'm specifically discussing about the physiology, right? So, to be very honest, ये topic जो था जब सबमिशन में मैंने देखा, so I never read this topic in my PG because I never found time to read the physiology because इतना कुछ था पढ़ने के लिए colon rectum के अंदर कि I didn't give preference to it. But when I read 3 days back, तो मैंने पढ़ा, तो I realized I learned lot of new things जो अब तक being a consultant things I didn't practice. But also, but when I read them, I found them quite amazing facts which were hidden in the system. So आज का टॉपिक हमारा फिजियोलॉजी पर है. So moving on to just hold on. So this will be the हमारा flow of lecture जो हर lecture में होता है. There will be some MCQs. Then we will discuss the theory. Then there will be the post test. So what I'm going to cover today, I'm going to cover recycling of nutrients which happen in the colon, absorption of in the colon, secretions in the colon, motility of the colon, and how the stool are formed and how the defecation process happen. So ये एक बहुत simple pathology नहीं है. There are a lot of things which control this. So it is a quite an interesting physiology, right? So अगर if I can summarize the physiology of colon and rectum in one slide, it is like this. There are two basic functions. Number one, colon का main function है recycling of nutrients, right? And rectum का main function है elimination of stool. But recycling of nutrient is a broad term. There are a lot of factors which helps in recycling of nutrients, right? So can anyone tell me what is recycling of nutrients? ये term का मतलब क्या है? You can write the answer in chat box. So basically recycling का basically ये है कि lot of nutrient, majority of nutrients are absorbed in the small intestine, right? But only, just hold on please, silent my phone. So majority of nutrients get absorbed in the small intestine, but small part of nutrient remain undigested. So in the colon, this undigested nutrition का जो recycling होता है वो हम recycling of nutrient बोलते हैं. That is a very important part, right? So question number 1, this is a pre-test. What is the primary function of the colon? Elimination of the stool, recycling of nutrients, absorption of vitamins, none of the above. Question number 2, what are the primary end product of bacterial fermentation in the colon? Ethanol, short chain fatty acids and gases. SCFA means short chain fatty acid, nitrogen and ammonia, glucose and fatty acids. Question number 3, which of the following condition is associated with increased colonic potassium secretion? किस कंडीशन के अंदर कोलोन पोटेशियम ज्यादा सिक्रीट आउट करता है ल्यूमन के अंदर? डायबिटीज, क्रोनिक रेनल फेल्योर, हाइपरथायरॉयडिज्म एंड एनीमिया. क्वेश्चन नंबर 4, which dietary fibers are not fermented by human colonic flora? Celluloses, food pectins, lignin and psyllium starch. So which SCFA means short chain fatty acid is a principal energy source of colonocyte? Acetate, propionate, butyrate, lactate. Question number 6, what is the primary substrate of cholesterol synthesis in the liver from short chain fatty acid? वैसे किस टाइप का short chain fatty acid हमारा cholesterol synthesis में help करता है? Propionate, butyrate, acetate and lactate, right? So what is the function of prebiotic? It is not pro, it is prebiotic. Provide direct nutrition to the colonocyte, stimulate growth of the intestinal flora, act as a source of dietary protein, and enhance fat absorption. What is the main source of energy for intestinal bacteria? Protein, dietary fiber, fat or simple sugar. Guys, so ये topic इतना interesting है. Colonic flora जो हम बोलते, which we always read कि there are some helpful bacteria, but you will amazed to know that इस बैक्टीरिया का बहुत इंपॉर्टेंट रोल है हमारी ओवरऑल गट पैथोलॉजी के अंदर। क्वेश्चन नंबर 9, हाउ डज अ लो प्रोटीन डाइट इफेक्ट द कोलोन एबिलिटी टू रिसाइकल नाइट्रोजन? Decreases the nitrogen recycling, does not affect nitrogen recycling, increase nitrogen recycling, inhibit nitrogen recycling. So choice number A and D are same basically. So अब हम डिस्कस करेंगे theory. So to start, I will first discuss the normal digestion process. Normally body के अंदर क्या होता है? It is seen that the nutrient which we ingest get diluted with the biliopancreatic and GI secretion, which basically help in the absorption. Basically that break down the nutrient and help in the absorption. So majority of the ingested nutrient get absorbed in the small intestine itself, and also along with the nutrient there is absorption of some fluid and bile salt. But it is seen that there are certain amount of nutrient which get indigested. This indigested nutrient reaches to the colon. So ileal effluent composition, जो हमारा ileal से colon में जो amount fluid जा रहा है, it is rich in fluid, water, electrolyte and nutrient which are resistant to digestion. Right? This is very important. So basically colon का functionality क्या है? Colon basically जो water electrolyte आ रहा है उन्हें absorb करता है, प्लस जो न्यूट्रिएंट अनडाइजेस्टेड रह गए हैं उन्हें रिसाइकल करता है. दिस इज वेरी इंपॉर्टेंट. और इस रिसाइकलिंग प्रोसेस के अंदर, इस वाटर अब्जॉर्प्शन के अंदर, इलेक्ट्रोलाइट अब्जॉर्प्शन के अंदर और न्यूट्रिएंट अब्जॉर्प्शन के अंदर बहुत इंपॉर्टेंट रोल है हमारा बैक्टीरियल फ्लोरा का. राइट? सो दिस रिसाइकलिंग ऑफ न्यूट्रिएंट इज होली एंड सोनली डिपेंडेंट ऑन द बैक्टीरियल फ्लोरा व्हिच इज देयर इन द कोलोन. एंड वी विल डिस्कस इन डिटेल कि मैकेनिज्म क्या है. So I will discuss few slides about the colonic flora. It is seen that more than 400 of bacterial species are there in the colon, and bacterial density is quite high, as high as 10⁻11 to 10⁻12 per gram of the bowel content. Bacteria constitute 50% of the fecal mass. This is quite high. Basically 50% of mass of feces is bacteria, and this can be your MCQ. सबसे commonly species कौन सी मिलती है feces के अंदर? Answer is Bacteroid species. This is most commonly found in the colon, right? Along with the bacteroid, there could be facultative anaerobe, there could be E. coli, there could be Klebsiella, Proteus, Lactobacillus, and Enterocoli. So along with that, these are also seen. So I move on. So what is how the colonic flora help in recycling? So it is important to know that जो indigested nutrient हमारे colon ह्यूमन तक आ रहे हैं, ये फ्लोरा उन्हें ब्रेक डाउन करती है. राइट? दिस इज हाउ इट रिकवर द न्यूट्रिएंट्स. राइट? एंड बेसिकली जो इनका डाइजेशन का एंड प्रोडक्ट होता है शॉर्ट चेन फैटी एसिड, व्हिच आर बेसिकली आर वेरी इंपॉर्टेंट न्यूट्रिएंट्स. राइट? सो दिस शॉर्ट चेन फैटी एसिड्स which are end product of breakdown of nutrients by the bacteria serves as a principal source of nutrition for the colonocyte. Just remember guys, जो हमारे कोलोन की एपिथेलियम है वो न्यूट्रिएंट ब्लड से नहीं लेती है, वो न्यूट्रिएंट लेती है ल्यूमन से. और ये न्यूट्रिएंट्स कहां से आते हैं? शॉर्ट चेन फैटी एसिड, जो कि न्यूट्रिएंट सोर्स है क्लोनोसाइट का, दैट इज फॉर्म्ड बाय ब्रेकडाउन ऑफ द न्यूट्रिएंट बाय द बैक्टीरिया. सो अगर बैक्टीरिया नहीं होगा तो हमारा शॉर्ट चेन फैटी एसिड नहीं बनेगा. सो देयर विल बी नो न्यूट्रिशन ऑफ क्लोनोसाइट. So that is why they are so important. Apart from providing nutrient to the colon, right? Apart from recycling of the nutrition, it also maintains epithelial integrity and protect against harmful pathogen. We already know that कि tropical जो हम oral diet का क्या importance है, यही importance होता है. And along with that, it stimulates epithelial differentiation and promote angiogenesis and also immune function. So colonic flora का बहुत सारे important roles होते हैं.